audience to join in.
Sounds good.
But does not looks good. It's zero.
You know, but we can also record and re-upload it, right?
Yes, sir.
Okay.
Definitely we can
Okay.
upload it. What's the time in USA right now?
Now it's 7:30.
7:30 morning.
Yeah.
Sunday, right?
Yes.
And our Sunday is just on the edge of ending.
I know
7:30 p.m.
because it's the long weekend, so there are a few days off. Okay.
So is the comment section open here? I just don't know because it is showing some messages such as potential spam may not be visible and
Okay.
rest is visible.
Okay. I think there are four viewers now.
Yes, sir. People are joining. We can just wait for 5-7 minutes. Then we'll
Okay.
start.
Okay. Sounds
So, sir, first of all, I would really thank you for joining in and appreciating my idea and also supporting it in the
good. Oh no.
first call only.
Oh, thank you so much for inviting. I think this is great.
It's liter it's really great. It feels great and obliged that I'm sharing screen with a huge personality like you.
Oh no, no, thank you so much.
People are joining in. So, what would be the topics you would be covering today?
So today we'll talk in general about constipation. In terms of like a basic, like what's the different types of constipation and what's the basic approach and treatment part.
Treatment
And
mainly,
yeah,
because the layman population wants to know how they can prevent it.
yes, yes. So all those we will cover today. And
And
we
also,
go ahead.
you must be talking about the symptoms also, right? That should
Yes,
not be ignored,
yes,
and the risk factors which could be there if
yes. We
symptoms
call
are ignored.
we call it the red flag signs. So those are things which if you have it along with constipation, things which you should not ignore at all, and which might need sometimes a little bit more workup.
Yes, sir, definitely. It is 7 o'clock here, 7:02. We can
Okay,
wait till 7:07.
okay.
You'll be discussing about the myths and facts also, right? I'll be
Yes, we will
asking you some myths and facts, then you need to confirm if it is a term, myth or a fact.
definitely we will talk about those as well.
Sir, Sayam Bansal wants to ask something. Sir, how do you describe navel? Navel displacement with correlation to constipation.
I think this is something which flies around a lot in the media, sometimes also in the in the local talks and all, but I don't think there's a lot of direct connection between the
Naval
two.
displacement.
Yeah.
So you must have not
You
taken
know,
your breakfast also.
so
You just
usually in
came
my
to live with.
schedule, I usually don't eat breakfast. I usually do skip breakfast. Yeah, I can hear you.
So you should know this is the important part of our routine.
I think that's a very big debatable topic. I mean, I just don't eat because because of the schedule how it works. I sometimes skip breakfast, but there are two schools of thoughts which would support either way, that you should eat breakfast, and people who would say breakfast is probably can be skipped. So I probably am on the second side, so
Okay.
I do skip breakfast most days.
And we don't want to debate it here
Yes,
on this topic right
yeah,
now.
that would be very controversial topic.
It would stretch a long way.
Yeah.
So, sir, I think we can join now.
Okay.
It's 7:05.
Okay.
Okay, so we have 11 of us. We are here, 14 of us. People are joining in. So, what do you want? Like, you want me to wait or we can just start?
No, we can start.
We can start. Okay, so I would like to introduce Dr. Shan to you all. Dr. Shan is basically a gastroenterologist, consultant gastroenterologist working in USA. He has done his MBBS from Kerala, India, and then he came from India to USA in 2014 and did his internal medicine residency in US itself. And then after that, he has done his fellowship in gastroenterology. And now he has got a great fan base following on his YouTube and Instagram pages also. So, sir, on behalf of everyone present here, I would like to welcome you and just please aware us about the constipation on this auspicious occasion of Constipation Awareness Month.
Thank you so much for that great introduction. So, constipation, this topic is very significant because even though it's not like an emergency situation, but it definitely has so many effects on people's lives. And there are people who are not able to go to work because of this condition when it is severe. So this has a lot of implication on a day-to-day life of people and our mental health as well, in addition to physical health. So overall, what is constipation? It means different for different things. There are people who would say, I would have one bowel movement maybe once every 2 days, and that is my normal, and they're happy with it. So it is very different for different people. So in terms of defining constipation, it's very hard to define because of how subjective it is. But overall, we still have to make some definition of it. So for some patients, it might just be like you have to strain a lot to have a bowel movement. For some patients it might not be the straining issue, it's just that the stool bulk is very low. For some people it might be because even after having a bowel movement, you don't feel at that satisfaction, you don't feel a sensation of complete evacuation. For some people it might be just they don't have enough bowel movements a week. So if you have to put a number to it, if you look at all those gastroenterology textbooks or medical textbooks, less than three bowel movements per week definitely comes under the criteria for constipation, in addition to other things that we talked about. So this is in general what constipation is. Again, there might be symptoms which I might not have said right now, which might be a purely subjective symptom for different patients. So it's very hard to define it specifically, but it's very different for different people. So this is in general
So, sir,
about constipation.
basically, it is just a myth that we should have a bowel movement daily. In India, we have this saying.
That's definitely true because because considering how subjective it is. Because I have so many patients. When I ask them how many bowels do you have a day, they'll be like, no, I have one in every 2 days, and they're fine with it. They're satisfied and they're
They are
happy.
fine with it.
That's their normal. So there's no strict numbers that you should have every day. But obviously, overall, right, most of the normal people at least have 1 to 2 bowel movements a day. Most of the normal people, that's at least the general norm.
Okay, so it is basically, it differs from person to person, we can say.
Yeah, it's very subjective. So that's why, when we talk to doctors, right? So when let's say we are talking to, so I work in gastroenterology purely, but so many people will be seeing constipation. General physicians, medical students, they're always seeing constipation. So one thing that we always say is, just because somebody tells you that, oh, I have one bowel movement every day, but they still tell you they're constipated, that does not mean you can brush aside that symptom. That's very significant from the patient's perspective. For them, it might not, they might still be having bowel movement every day, but their issue might be they have to strain a lot, or sometimes they don't feel complete evacuation. All that is significant symptoms which would still come under the general umbrella of constipation. So the next part is,
So you can continue
so
with.
this is in general about what I want to say. How can we define, or how can we bring into this symptom per se of constipation?
Yes, sir. Sir, your video is actually hanging.
I'm able to,
It's okay now, but
it's going okay. Okay. Now, can you hear me? Yeah.
yes, sir,
Yeah.
we can hear you.
Now, the next question is, what all are the main causes for constipation, right? If we have to do some broad criteria to to place this into. Can you hear me still? Can you hear me?
Yes, sir, I
Yeah,
can hear
yeah.
you.
So we were talking about how to, broadly in terms of, like, causes of constipation, how to broadly define those. So broadly, constipation can happen for somebody without any pathology at all. Right, their intestines may be completely normal, but they still have constipation. There can be scenarios when there's an actual disease which is constipation. So in order to capture all this, broadly, when you categorize constipation, there's something called secondary constipation. Basically, secondary constipation is secondary to some other disease pathology.
Yes, sir.
Then there is chronic idiopathic constipation, which there is no significant disease per se, but there is significant constipation. And three, there's irritable bowel syndrome, which is a separate category. So secondary constipation can be again divided, like it can be neurogenic, non-neurogenic, or medications. Basically, if that, let's say somebody has a neurogenic issue, say like multiple sclerosis or Parkinson's disease or spinal cord injury, that's all neurogenic constipation. Non-neurogenic causes for constipation, the notorious one is thyroid disorder. So people with low thyroid hormones, that's notorious to cause constipation. Diabetes is the second one, which is known to cause it. Then certain electrolytes are very important for our bowel movements. So calcium, magnesium, potassium, imbalances in those can also cause constipation. So those all come in the non-neurogenic
Secondary.
constipation. Third is medications. Medications are notorious to cause constipation, especially some ones. The most common culprits are certain blood pressure medications, ones we call calcium channel blockers, like amlodipine and all, because they do have some effect on smooth muscle relaxation of the intestine. So that can also constipation. Uh, at least if this is much less in India. In US, there are more patients on opioids for pain. Opioids are the other one, which is notorious to cause a lot of constipation. So this is a secondary constipation, but this is not the common ones. Most of the people who have constipation does not have any sort of disease or pathology, but they still have constipation. So that's a second category, the chronic idiopathic constipation. Now, this is again divided into mainly three: people who have a normal transit, slow transit, and defecation disorders. Normal transit means the patients who have constipation, but their actual bowel transit or the transit of a stool through the bowel is completely normal. Second is slow transit. This is not a disease, but they have constipation, but at rest they do not have any slow transit. But if you eat something, or if you actually, even if they take a laxative, their transit through the large intestine is slower. So that's slow transit. The third one is this defecation disorder. This is mainly comes under the category of something called dysenergic defecation. Basically, in order to have a bowel movement, right? There are so many, even though it's a very simple event for us, there are so many complicated physiological things which has to happen. The most important one is once the stool is in the rectum, the rectum has to contract and the sphincters has to relax in order to have a bowel movement. Some people, this does not happen in a fashion. So that's something called dysenergic defecation. Third one is irritable bowel syndrome. It's a separate category where just beyond constipation, some other symptoms come into picture like abdominal pain, bloating, things like that. So this is how we mainly
Yes, sir.
categorize constipation. Now, this does not have a lot of implication on the basic treatment strategy, right? Like obviously, we want to know if there's a secondary cause for constipation. Like as we talk, if I see somebody with severe constipation, I will make sure that I check their thyroid hormones, make sure they don't have diabetes. Just
Hmm.
do a basic electrolyte workup. We do want to do all that. But beyond that, this kind of categorization does not really affect our treatment per se. But it is important to make sure that we are covering our bases. So this is
Yes,
in
sir.
short about how we categorize.
Definitely, sir. It was a good categorical description by you. So some people are asking question. You can just check out which are to be answered.
Okay. Now, there was an interesting question about the gut microbiome and the gut motility. This is a I am a firm believer in this theory that probably we have to give much more importance to the gut biome than what we actually give it. The main reason for that is it's still an evolving field of research, and it's not easy to do research on this, so that's why it still needs time to catch up. So I definitely do think there is a definite correlation between the gut microbiome that we have and the symptoms we have, especially constipation or diarrhea. Now, the big question is, what do we do about it at this stage? Because we have to evaluate at the phase where our medical field is right now. Right now, let's say if somebody comes with severe constipation, I would not be testing their entire gut microbiome, because even if I find something unusual there, we don't have a specific treatment to go after. But obviously, there are instances like there are conditions called methane small intestinal bacterial overgrowth, where you get a lot of bacteria in the small intestine which generates a lot of methane gas. Those patients usually come with severe constipation. And actually, I recently had a patient who has had years and years of this symptom, but we tested it and we found this methane bacteria overgrowth, and when we go after it, that significantly improves symptoms. So that's one thing. But obviously, I think the question is more in relation to in the general gut microbiome. I'm pretty sure in the future we will have specific options to target uh, those microbiome part of it and treating it.
Microbiomes.
At this stage, the main treatment of constipation unfortunately does not involve targeting those at this point.
Yes, sir. Correct. Actually, there are some people from the medical field also. They are asking these questions. Any other question you find relevant?
Yeah. So there was another question that we answered: how many bowel movements are normal per day for a healthy person? That's a very subjective thing. So for some patients or some people, it's just one bowel movement every 2 days is their normal. So that's
That
very
you told.
subjective. Yeah, that's very
Yes,
subjective.
sir. So
um,
there's this one question. How does gut motility impact chronic constipation?
so that's
And are there emerging therapies specifically targeting the aspect of more?
So
effective management.
regarding gut motility and constipation, that's exactly what we talked about in that classification. So there's people with a normal transit, which is basically means their motility is normal. There's people with a slow transit, where they have a slower transit of contents to the colon. So, in terms of diagnosis and treatment part, if you really want to know if there is a delay happening in your large intestine, there are certain radiological tests that can be done. They're called radiology tracer tests, where you ingest certain tracers and they actually measure how many of those tracers get to the bottom, to the end of the large intestine at the end of the test. And there are certain criteria to see if you actually have a delay in transit of those tracers. That test is usually not done because even if, let's say, we do find it, then that it does not affect specifically the treatment per se, at least in the basic stages.
Okay.
Now the question of if we have options to target the motility per se in in treating, yes, definitely. So that's when, any treatment options that we use for constipation, we again is broadly divided. There are ways in which we increase the bulk of the stool. That's one treatment option. There are ways in which we give medications to drag more water into the large intestine to help our movements. And three is definitely where we give agents to stimulate that gut motility.
Laxatives.
The most common one that you guys probably know is Dulcolax or Senna. Those are all ones which act on the gut motility part of it. Now there are also some more newer medications which have come onto that side, which acts on the gut motility per se. Procalopride is one newer one which has been there for the last few years. Again, as specific, it acts on the serotonin receptors and specifically acts on the gut motility.
Gut motility.
Motility, yeah.
Okay, so the treatment won't be changed
The
depending on the motility.
we don't test extensively for it because our basic, so when we see somebody with severe constipation, right, we need to always sort of balance the the benefits of treatment and if any risk or anything which come with it. So we always try to do the most benign thing first, which is the least side effect,
Yes,
which is the
sir.
most benign thing. So that's
The
why I said,
basic
yeah. So
treatment.
the basic treatment always, so it goes step by step. The most important, the usual thing, drinking enough water every day, increasing the fiber intake. If we are not getting enough fiber intake from the food, then doing a fiber supplementation. Even if you're eating enough fiber, if you're still constipated, taking some fiber supplementation from outside, like psyllium husks, things like that. So those are the most basic things and benign things because these are just natural and you don't get any side effects from it. So that's why no matter if it is normal gut motility or some delay in gut motility, we always go through these steps for treatment. And
Yes, sir.
they don't respond, only then we escalate to the other laxatives that we talked about.
The primary treatment would be same.
The basic
That
that
is.
the first steps should be the same for everybody.
But sir, in some cases I have heard that fiber intake just worsens the constipation.
So it's not necessarily constipation per se, but it's usually the other symptoms which come with it. Like abdominal bloating is something.
Bloating
Yeah,
and
yeah. Bloating and
okay.
abdominal cramps can get worse with fiber. Not for everybody, but for some patients. That has to do with the fact that most of the fiber is not absorbed before, right? So everything that we eat, most of the fiber, majority of it goes to the intestines, get metabolized by the bacteria, produce more gas, things like that. So fibers are basically divided into soluble and insoluble fibers. Soluble is water soluble, insoluble. So if you look in the, if you look for examples, you'll be able to find, like online, there are multiple examples of which are the soluble fibers, which are insoluble fibers, which are the food items which is high in each. Insoluble fibers are notorious to cause more
Constipation.
not constipation, more of abdominal cramps and abdominal bloating.
Okay.
So that's one. So whenever I get a patient and and they have constipation, but they have a lot of abdominal bloating and cramps, I always tell them it's okay to take fiber, but get a small amount. Don't get like a big jar of psyllium husk. Get a small amount. Just give it a try. Just give it a few days. If your bloating is much worse, just stop it. So that's what I usually recommend.
So it just does not worsens the constipation, but just other symptoms
Other symptoms sometimes can be, some people just don't tolerate
versify.
fiber. You know, so I personally take mycelium husk every day, but I can tolerate it well. But somebody else I know, they don't tolerate
It
it. So
might not suit to the other
yeah,
person.
yeah,
Definitely. Yes, sir. We can just check out the other questions.
okay. Chronic use of laxatives hurt me or become addicting. So this is regarding this question. You know, this is a question that I always get. Chronic use of laxatives hurt me or become. So this is exactly one reason why we usually don't start patients right away on strong laxatives. We usually try this fiber and other treatments first. Now, in among laxatives also, as I said, there are different mechanisms that we target. Some of them just absorb more water into the gut, thereby having more bowel movement. Some just stimulates the gut motility, things like that. So if the fiber does not help, increasing the water intake doesn't help, then the next step that I usually do is by adding a laxative which works by dragging water into the colon. The reason why that's safer option, or that's the next to go option, is because that does not have any sort of long-term effects. It's just still a natural process. The usual laxatives that we use in the polyethylene glycol, lactulose, things like that. So basically, when they get to the large intestine, because of their they're able to drag water along with them. Those, even when taken over long term, does not have any significant effects. But the laxatives which target the motility, like Dulcolax, which actually work on the muscle contractions, those over long term historically has said that they might, your the gut might slow down, might become just non-responsive after a while. That's been anecdotally what people has always talked about, but there's been some newer research which has come into this, which has said, if you want it, you should take it, and this is probably not true, that it would just goes into the fancy name is colonic inertia. That's a fancy word for this unresponsive gut. So some of the recent data said it's probably not true. So if you're not responding to the other laxative, if you want to take a stimulant laxative, like, you should probably take it. But obviously, like just like any medication, the best would, if you're able to supplement it with fiber, water, and if you're able to get away with without taking medications long term, that's always the best method.
But taking the laxatives for chronic time, it can be addictive.
So I
That's
wouldn't use the word addictive. So, as again, most of the laxatives does not cause any.
saturation of
Yeah,
the patient.
it does not cause any. Most of the laxatives don't use, especially this polythene glycol, things like that, which works by absorbing water into the gut. They usually don't cause any issues even when turned long term. But obviously, we should be very careful not overdoing things. There are instances where people do a lot of laxatives. They, as a means, what they assume is a detoxification. Like sometimes they get multiple bowel movements, severe diarrhea. That can sometimes be very harmful. Not from the diarrhea per se, but when you have bowel movements, you're losing a lot of electrolytes like potassium, things like that. So you don't want to risk that. So that's one different aspect of it. But in terms of this addiction or losing the response later on, there has been some historical talk about the stimulant laxatives, but overall that's still debatable. So I use it only if I really really need to, in terms of long term use of those stimulant laxatives.
And for some people, it also gives psychological satisfaction taking the laxatives on a regular basis, that it
You
is
know,
detoxifying my body.
that's true, and that has to do with the how intricate is bowel movements to our life, right? It's a simple thing, but it is. But if you're constipated for 2-3 days, then you go through that mental agony. So that's how intricate it is. That's just how our human physiology is.
Correct. Now, sir, please share some tips that can be taken to prevent constipation, like basic lifestyle changes people can opt.
So in terms of basic lifestyle changes, so a few things, when it comes to diet, drinking enough water, just
Fiber,
making sure
water.
you're hydrated. That's very, very important. Second is, in terms of fiber. So there was a question like how much fiber to take, right? So if I had to put a number to it, if you look through resources, 25 to 30 grams per day of fiber. Now, before we had all our smartphones, it was very hard to assess this fiber content. But now we all have smartphones, and we can. There are multiple apps which we can use to actually. You just have to put what you're eating, and it will tell you exactly how much fiber is in there. So, 25 to 30 grams total fiber per day is what we in terms of fiber intake. Now, it's a long list of which food items are high fiber. Now there are vegetables in them, there are fruits, there are legumes, there are all those. Those are all freely available to everybody. So fiber intake is one, water is one. The third is exercise. Exercise probably has a very important role in terms of constipation. Uh,
Mobility.
yeah, and I can speak this because many times, right, we see the patients get admitted into the hospital for something else. This we see all the time. They get admitted, let's say for pneumonia or something else, and they're in the hospital bed for 3 4 days. They go into constipation. That's not because there anything new happens, because of no mobility. So they're not moving. They're just laying.
Yes,
So
sir.
that's it. Most of the times, um, when those patients, we do add laxatives, but the main thing that we do is, we make sure they
Mobilizing the
walk
patient.
around the ward multiple times an hour, and
Yes.
that really helps. So exercise. So let's say, a normal person who is not sick, who is not in the hospital, even then those patients also, daily exercise has benefit in terms of preventing constipation. Four, sleep probably has a role as well. Getting adequate sleep deprivation is significantly associated with any sort of bowel issues, and definitely constipation. So these are some of the things in terms of lifestyle. Now, obviously, stress. All of us have stress.
Stress.
And the thing is, we all are. Every human body is completely different. The way people react to stress, not consciously but unconsciously, is very different. So there can be instances when stress can cause significant symptoms in the GI tract. The most notorious ones that I see in my practice is, abdominal bloating, where very stressful situations come, you get all these symptoms. But constipation can also be something which can be triggered by severely stressful situations. This again, somebody there was a question about enteric nervous system. So basically, what enteric nervous system is, it's basically like our second brain. We have a brain in the head. Enteric nervous system is that sort of neural connections which are around the intestines, large intestines, and all. And this is connected to a brain, and from a very general perspective, probably vagus nerve is the one which sort of is like a highway between these two.
Supplies.
Yeah, between these two. So that's probably the connection, how things happening in the brain like stress can affect the intestines, and things in the intestines can definitely go back affect the brain as well. This is
Brain.
this is where some of the newer research shows how our gut microbiome might have a connection with our mental health as well. So just to give that perspective. So
And so, like binge eating during the stressful period can also trigger the constipation, right?
that depends on what you're eating. Obviously, if you're eating a very low fiber low fiber foods,
Then
that can
it
definitely trigger constipation. So this is probably some of the things that obviously we cannot remove stress from our life. That's not easy. That probably won't happen for any of us. But sleep is something which we can work on. Some sort of exercise every day, fiber, water, all the things to prevent constipation.
Yes, so exercise, I deeply believe that exercise is very important because I'm a physiotherapist, and to improve your respiratory health or any sort of mobility in the intestine, it is very important to do the exercise.
Yes.
And early in the morning, exercising is very important.
And I think Yash has asked, please share your knowledge on dyssynergic constipation. I think we just talked about it, Yash, actually. So, basically, I was saying, in order to have a bowel movement, a very complex r- steps has to happen. So, the stool has to come to the rectum, and the rectum has to contract. There's some more other physiological steps, and then our sphincters, the anal sphincter, has to relax. This all has to happen in a coordinated fashion in order to have a bowel movement. Some people, it just doesn't happen. That's called dyssynergic defecation. So this is the next thing I want to talk about. So, you know, what all, how do you work up constipation, or do you have to do any workup? Most of the times, right, patients comes to me for constipation. We do these basic things that we talk about, make sure they don't have any thyroid issues or diabetes or any electrolyte issues. If not, we just focus on the treatment part. Now, there are instances when we might have to investigate a little bit more. The me as a gastroenterologist, when so colonoscopy is one thing. So, do you need colonoscopy for evaluating constipation? Not really in the right sense, but there are instances when we have to. So, these are something called red flag signs of constipation. Things which come along with constipation, we should be in a little bit alarm state. The reason why we do this is because there's one thing which we should never miss in somebody who has constipation. That's colon cancer. We don't want to miss that. So, if you have blood in your stool, if you have weight loss, if you have a very strong family history of colon cancer,
Colon cancer.
and if your age is more than 45 to 50 and you are experiencing a new change in your bowel habits and new constipation, these are some of the red flag signs that if we find it even in somebody's constipation, I would probably be on a little bit more alarm state. I would probably investigate a bit more, do a colonoscopy. Now, the other test that we talked about, so coming back to desacidification, let's say we see somebody with constipation, we did all the lifestyle changes, we did some basic treatments, but it's not working. Then we have to investigate for these other things like dysenergic defecation and things like that. The test to evaluate those are not easy. This is something called anorectal manometry. It's not an easy test, and it's not something which anybody would be comfortable doing it as a patient, because it has catheters going in and checking the pressure measurements in the rectum and the sphincter, things like that. So the relevance is, if we do diagnose people with this dysenergic defecation, the main treatment is actually a special physical therapy. Actually, so you probably know, it's called pelvic biofeedback therapy. So that's what we
Yes,
do in
sir.
order to retrain them how to regain that coordination between the rectal
Pelvic
muscles.
strengthening,
Yeah, between the rectal
pelvic
muscles and the
floor
sphincter.
muscles.
Yeah. So that's called pelvic biofeedback therapy in order for dysenergic defecation.
Yes, sir. So, sir, I think the comments are endless. We can go with the myths and fact.
Sure, sounds good.
You can just confirm what are the myth and what are the facts.
Okay, sounds good.
So the first one is castor oil is a cure, especially in India. It's a saying.
You know, definitely all those are, before we had any of the laxatives that we have now, right?
Treatment.
These are the ones which has been used for many centuries. And castor oil, mineral oil, those are all the ones that we have used. Now, if you don't have any other secondary causes for constipation, and this is something which has worked for you, it probably works, but it's not like an just a one dose cure for every forms of constipation. That's probably why in the mainstream medications of constipation does not often come there in the picture.
But it can be a first line treatment. We can just try
It's just
it.
people, it's like a home remedies that people have tried, and obviously
Home remedies.
over centuries people have used it, and it has helped them when they have used it, but not everybody gets the same benefit. Again, every different human being is completely different. Medications work different.
Correct. Okay, sir. Now, colon cleansing helps. Is that so?
This is in terms of colon cleansing, right? So this is what I was talking about. Sometimes, we get ideas that this is a very good detoxification. We need to get some people do this
Rid of it.
bowel cleansing regimes. I usually, at least in my practice, I don't recommend those because sometimes things can backfire. Because when you have those multiple bowel movements back to back every day, you can get some significant electrolyte issues. Like namely those we talk about, this potassium, magnesium, calcium, all those can imbalance can happen, and you don't want to end up in an emergency situation by doing something that you thought what you were doing, with good intention and just for better health. So usually, if you're having regular bowel movements and you're not having any of those red flag signs, I usually don't uh,
Recommend.
prescribe anybody bowel cleanse, um, because again, things can sometimes backfire.
Yes, sir. And so things like workout gets you going and more water helps. So you have already told
Yeah,
these things.
yeah.
So one, there is a myth. One, prunes, dried fruit are powerful. What about this?
Yeah, prunes are again, these are time tested. One prunes is very good in fiber, and prunes is one, prunes and other fruits which help in constipation. They also have this content called sorbitol. Sorbitol is also something which can drag water into the colon, have bowel movement. So this is very effective. So prunes, prune juice, they've all been time tested. And when we talk about the benign things like the non medications you can take for constipation, these all come under that.
Okay, so this is also a home remedy
This
which can
definitely,
be
yeah, just like
taken.
any fruits, any vegetables, all those.
And so, is a medication for any other primary disease can be a cause to
That's
constipation?
what we talked about. Yeah, some medications are notorious to cause constipation, at least in the regular practice, right? The blood pressure medications, the ones called calcium channel blockers, like amlodipine, verapamil, diltiazem. These are all calcium channel blockers, and calcium is one ingredient in any sort of muscle contractions, right? So calcium channel blockers are notorious to cause constipation. Second, and we talked about these
That
opioid pain medications. Those are the ones which are
opioids.
notorious to cause constipation. These are the ones which come in regular practice.
Okay. And so, other medication like diabetic medication and
So
thyroid won't be a harm.
no, so if you have low thyroid, you get constipation, and probably taking thyroid medications and fixing your thyroid probably helps the constipation. Diabetes, there are certain newer
Okay, it would help.
even there are certain diabetes newer medications in diabetes which the by means of their mechanism of action, they can slow down the entire gut transit a little bit. They can sometimes cause constipation. Those are those injection medications, like Ozempic, Trulicity, those kind of ones. They just the way mechanism of action, they can sometimes slow down the gut transit. But so these are in terms of medications.
Okay, so the next statement is holding your stool won't hurt. I think it would hurt.
That's why they're talking about, if you want to have a moment but you just keep waiting, this is, I'm purely talking on behalf of one of the professors I had back in medical college. He was a surgeon. He would always used to say, the best time to have a bowel movement is when you get the nature score. So when you get the urge, that's the best part. Any other time that you'll be having, there's training involved and things other things which I have to actually actively do. So the best time is to not hold and just answer the nature score.
Okay. So it would definitely hurt if you won't listen to the nature's call.
Definitely.
And your mood matters, as you already told about the stress
Yes,
thing.
yes, yes. Stress definitely has a role in any sort of uh, me being in gastroenterology, any gastroenterology issues, stress has a definite role. Even people with a definite gastroenterological conditions, right? Stress can always make things worse. So there's one question: constipation
And
is
sir,
diagnosed only based on frequency of bowel movements. Yash, we did talk about it. It's not just purely based on frequency. So it's too subjective. Some people, they have bowel movement every day, but they still feel constipated. So it's not purely based on frequency alone, that diagnosis.
it's also dependent on how much strain you need to put to it.
Yes, yes.
And so the next statement is your vacation could be a cause, like change in lifestyle.
Definitely, because that I think that's a crude way of saying, but more simple, like, every time there's a major lifestyle change, like the diet that you consume, our daily exercise routine, any change in that could have a definite effect on the bowel movements and cause constipation. So,
So constipation can be induced from lifestyle changes also.
definitely,
That
definitely,
you mean.
yeah. And
So the next statement is,
mhm.
does constipation induces toxins in body?
This is also probably, I would say this is probably a myth in most situations, like in the sense that if you're constipated, a lot of toxins build up and affect your body's working. That's probably not true, but there are instances where severe constipation can cause certain toxin buildup and affect patients. The notorious one is patients with cirrhosis. In patients with the severe cirrhosis, liver cirrhosis, when they get constipated, they get a lot more ammonia buildup. That's because ammonia basically comes from the gut bacteria, from the intestinal bacteria. So when you're constipated, there's a lot more ammonia being built up, which can cause certain mental confusion, some neurological changes. So that's one reason why in cirrhotic patients with that condition, we always have them on laxatives, usually lactulose, sometimes certain antibiotics for that, things like that. So this is one which I would say, it's a gray zone.
Is actually not completely. I think you need to be stationary.
Okay, okay.
Okay, sir. So this basically covers all the myths and fact. Now there is this one question. My doctor told me to try fibers, but my symptoms are worse.
That's probably what we talked
That's
about.
what you told.
Yeah, we talked about, sometimes
Yes, sir.
the way the fiber reacts to in our body is very different for different people. Many patients tolerate it well, but some patients, unfortunately, fiber increases their symptoms of abdominal bloating notoriously and abdominal cramps. And I'm, this is probably a hypothesis. This probably have to do with our basic gut microbiome as well, as to like if somebody tolerates it well, whereas somebody does not tolerate well. Probably the gut microbiome has a role to play in it. Another question: can regular exercising help prevent constipation? We did talk about it. Yes, exercise does significantly improve constipation and probably prevent constipation as well.
So there is one more good question that
Mhm.
some people basically oscillate between diarrhea and constipation. What could be the reason?
Could you repeat that question again?
Patient actually oscillate from to
Yes.
constipation.
So this is, when we talk about irritable bowel syndrome, right? There's irritable bowel syndrome, diarrhea predominant. There's irritable bowel syndrome, constipation predominant, and there's definitely irritable bowel syndrome mixed. So that's probably the most common reason why people have this alternating diarrhea and constipation. Um, and this is just how that condition is, irritable bowel syndrome mixed form. That can be very frustrating, in terms of treatment as well, because when you treat one, it goes to the other extreme. Now, one thing which I would like to add is, when we talk about fiber, right? We always talk about fiber in connection with the constipation, but fiber probably has a role in diarrhea as well. So in some,
Sir, could you please check your network connection?
so can you hear me? Yeah.
Yes, sir. Sir, network connection or yours? Actually,
I'm
I'm
not
not
sure.
able to figure it out.
Can you hear me now?
Your video is stuck.
Yeah. Is it better now? I am able to see you.
My video coming to you?
Yeah, I am able to see you. It's breaking in between, but I'm able to see you.
Okay, sir. So please go ahead with the answer you were saying.
So I was saying, this alternate diarrhea and constipation is most likely this is one of the patterns in irritable bowel syndrome, and probably fiber is something which might have a benefit in both. Like we always talk about fiber in connection with constipation, but there are instances where we give fiber for actually patients with the diarrhea. Sometimes the reason is because the fiber can absorb the water and sort of solidify the stool. So, in patients with this irritable bowel syndrome mixed type, where there is alternating diarrhea constipation, fiber is something which I always do prescribe because that has much benefit. There's another thing which can also do alternating diarrhea and constipation. That's one thing that we talked about earlier: small intestinal bacterial overgrowth. Small intestinal bacterial overgrowth is also something which can have these alternating patterns. Now, three, if somebody above the age of 45 to 50 gets new onset of these kind of alternating bowel patterns, those patients I definitely do colonoscopy to make sure there's nothing else unusual there. Want to make sure no colon cancer, things like that. And they're also, especially like in our Asian subcontinent, right? One thing, whenever we hear these alternating bowel patterns, one thing that we usually tend to rule out is tuberculosis. Is one thing which also we look into.
So, sir, you very nicely explained this question. It was a very frequent
Yeah,
idea in
yeah, and
constipation.
that's very frustrating for everybody, especially for the patients and for the doctors treating them as well, because the moment you focus on one, it goes to the other extreme. I can probably talk from fiber. Fiber probably has
In
benefit
these situations.
in both. Fiber has benefit in both these situations.
So, sir, this complete all the myths and facts and
Okay, sounds good. We talked about.
so there is one question. Is milk helpful in removing constipation?
You know, it's it's uh, it's hard to fully comment because sometimes when we drink milk, right, the ingredients in the milk get metabolized by the intestinal bacteria, like all the lactose, everything is metabolized, and the that metabolization leads to certain products which increases the bowel transit, which produces more intestinal motility, produces more gas, things like that. So sometimes it might help constipation in some patients, but sometimes it can go to the other extreme. many of us are lactose intolerant, and sometimes we are not aware of it, and especially after
Correct.
certain age group, we no longer make the lactase enzymes. So sometimes it can significantly worsen the abdominal bloating and cramps. But obviously, if you're somebody where milk works for you, again, anything which is non-medicine which you can take long term, that's the best option. So there's nothing against milk if milk works for you, but this is probably how it works. But there are instances where it worsens the abdominal cramps and bloating because lactose intolerance is very, very common. Um, I think most of the other things that we talked about.
So do you find any question? So there this one question, is warm water better than normal water in constipation?
Again, anecdotally, right? Anecdotally, it does. Anecdotally, it does. And when I say anecdotally, I would say from my personal experience too. Warm water probably is helps. In terms of if I'm able to explain exactly how the mechanism is, I'm not sure. I don't know. But there are certain conditions in the GI tract, especially in the esophagus and all, where cold food causes spasms, whereas warm foods go down okay. So I think it has to do with how the temperature affects the motility of the whole gut. So probably, again, from anecdotally, warm water seems to have some benefit in constipation.
So people are actually appreciating. It was a very helpful session. It was a
Oh,
very,
thank you.
very informative session.
Thank you so much. Awesome, I think.
On the food items which they should avoid and which they should take. So many comment are according to that only.
You know, I know there was some questions on Hindi. I think I can speak Hindi, but I'm not very, very fluent. In doing this talk, I mean, I might be able to do like casual talk. Yes, I'm from. Um, some question on how.
Sir, there is this one question regarding rice also.
Yeah,
Every food item would be covered in this video.
regarding rice, some would say brown rice tend to have a little bit more fiber in there. So in terms of if you're trying to connect constipation fiber intake, brown rice probably has some beneficial effect. But in terms of the question, does eating rice cause constipation? Not really. If you're keeping up with the fiber intake, like it does not lead to a constipation.
So excessive fiber can
What
also
was
be
that?
harmful. Excessive fiber, does it cause any harm to our body?
Excessive fiber is not harm per se. It's mainly large amount of fiber people probably won't tolerate because of the bloating it creates. It has to do because these are not digested, and many of it just goes and gets metabolized by the bacteria and produce a lot of gas. So it's not tolerated very well, like in extreme large amounts. But 25 to 30 grams, as we said, is at least a recommended intake.
And with this session, at the end, we know this thing, fiber is a key for both in constipation and in diarrhea as well.
I think fiber, yeah, fiber, water, exercise. Probably, I think those three are probably the main three in pretty much everything.
So, sir, questions. Is there anything you want to share? You want to aware us about?
Um, there's one more question: anti-allergic pills leads to constipation. that that is mainly because most of the anti-allergic pills, the majority of them are anticholinergic medications. Anticholinergic basically means they this has to do with the how the nervous control, I mean the nervous system control is on the intestines. So there's cholinergic system, there's sympathetic system. So you need cholinergic for motility. So most of the allergy medications are anticholinergics, and that's the reason why they cause constipation. That anticholinergic property of those medications probably what's helping the allergy part, because it reduces the secretions and all. But on the other hand, it does unfortunately affect the gut motility and cause constipation. Now, coming to your question, to add anything, I would say, you know, what I would probably recommend is, if you can find a a a benign way to treat your constipation, like fiber, water, exercise, that's probably the best way to do it. Two, these red flag signs that we talked about, just don't ignore it. I think that's my last word.
You. And of course, everyone would have learned so much
Oh,
from
thank you
you
so much.
because you have answered everyone's question here.
Awesome. Thank you so much.
It
It
was a
was great.
great
It was great
session,
session.
and just hopefully many sessions with you
Definitely,
in the future
definitely.
time also.
Thank you so much. Thank you.
And and on behalf of everyone, I'm very sorry for you to bothering you early
Oh no,
morning.
no problem. No problem. I
We all have bothered you early
no.
morning.
Thank you so much.
But thank you so much, sir, for awareing us about the constipation
Awesome.
and clearing us about all the facts and myth.
Thank you. Hopefully, more sessions in the future. We'll talk about different topics.
Yes, sir. It was nice session with you, and just looking forward to more such sessions.
Same here. All right. Bye, everybody. Thank you so much for joining. Great to have you all here. All right. Bye.
Thank you, sir.
Thanks. Bye.
Have a good day,
Okay.
sir.
Everybody have a great day.